developing practitioners' appreciation of outdoor learning to improve health and well-being for children. This was an action research project by myself, Gail Currie, for Dundee University. So, why did I choose health and well-being and outdoor learning as a focus for my research project? As an early years development officer, I worked across many early learning and childcare settings, developing child-centred pedagogy and practice. I observed that outdoor learning had less prominence when planning for learning compared to planning for learning in the playrooms. Outside staff were observing and interacting less with children outdoors, and they were missing some opportunities to follow children's interests. In some settings there was also 2 playrooms sharing 1 outdoor space, and there were no discussions between the 2 teams on the outdoor learning and what resources were required to extend learning, and there was no outdoor planning format to share. In some settings, practitioners facilitated outdoor play with less enthusiasm unless you had the title of the outdoorsy person. The rota outdoor person had to be happy in some settings to be out there all day in all weathers, and they didn't really take cover maybe every 20 minutes, half an hour when it was really cold or if it was really warm outside. So this then made the outdoor person less enthusiastic about the outdoor experiences. Also, more resources and engaged children were seen playing when it was someone who really enjoyed outdoor play. That practitioner put out more resources for the children, had more discussions and extended the learning. And also, I found in some settings that staff didn't follow the children for ratios. So instead of maybe 2 staff coming out if there was 10 children out, some places had only 1 member of staff that could come out that was the outdoor person, and they had to only allow 10 children out to keep in ratio. So it wasn't actually always free flow, and children didn't have access to outdoor play as flexibly as they should have. Promoting health and well-being and outdoor learning are a priority. COVID-19 guidance emphasised this, and COVID-19 happened when I was working on my research project. And to develop a way to record learning to highlight how getting it right for every child, the wellbeing indicators were embedded in practice. And the care expectant have these expectations also. They want to see evidence of GIRFIC in practice. And sometimes what they see is the token Shinari display in a room. And I'm sure you all know what I mean. And it's actually not reflected in recording learning in PLGs or within planning formats. Literature review. So before embarking on my research project, I had to gather evidence, and I carried out extensive reading. In my reading, I investigated outdoor learning to establish how this affects health and well-being. The care inspector expects provision for outdoor learning so children can connect with nature. This connection with nature is a positive nurturing experience which has an impact on children's physiological and holistic well-being, and can reduce anxiety, the effects of trauma and poverty as children develop resilience to stress. It is also an outlet for various types of behaviours, running, climbing, chasing, where children develop physical skills through these energetic outdoor activities. Free play outdoors with peers develops resilience, interpersonal skills, strength, stamina, and the experience of freedom. Theoretical perspectives. Outdoor environments have been revered by theorists. Isaac and Froebel valued the freedom of play outdoors and children learning through doing, giving the children the responsibility of cultivating plants and looking after animals. Children connecting to their natural world develops imagination, discovery, inquiry, and curiosity. This comes from an emotional need to understand their world. Realising ambition confirms that children require outdoor experiences to develop my sense of well-being and connect with the world I live in. Forest and Beach Kindergarten was introduced in Fife to develop this connection with outdoors. This caused much controversy at the time. Many practitioners could not see the value, and they did not embrace the theory and research behind this. Now, this is an integral activity with an abundance of learning potential. The Macmillan sisters were fundamental in reforming healthcare and illustrated the importance of outdoors for health and welfare of children, especially those in inner city deprived areas, with no natural environments to explore. Their theories are valid today, as more children are living in deprivation every year, and practitioners must address this by enabling children to access outdoor environments to develop health and well-being. This is a major concern for children's mental health after lockdown due to the COVID-19 pandemic. We've got to consider there are some children living in flats and built-up areas, and they may have play areas within their community, but these might not be safe. Children have less opportunities to play outdoors. This could be due to these communities that they live in, or society. There's a fear of loss that parents might have, and a worry for children playing out in the streets and in the parks. And there's also children and parents' mental health that's maybe stopping them accessing outdoor activities. Health and wellbeing focus. The early years framework prioritised outdoor environments to be supported in nurseries to develop health and well-being through play, and the chief medical officers in the UK advised that nursery-aged children should be physically active for at least 3 hours within the day, with access to outdoors. The Scottish Government, Inspiring Scotland, NHS Health Scotland, and over 100 organisations are committed to life-enhancing outdoor play. Due to the health and wellbeing benefits, they created a Scotland's Outdoor Play and Learning Coalition position statement to address this. The health and wellbeing of the nation needs addressed, and this is why developing outdoor play is so important. The hope is children enjoying outdoor activities will create healthy habits into adulthood. Learning through play. Outdoor play has more opportunities for what is termed risky play, which empower children to experience for themselves when it is too high or if it's wobbly. These experiences allow children to risk assess. Children who have explored risk during outdoor play with peers develop social skills, problem solving, creativity, and face challenges in a positive way. These challenges develop confidence and self-esteem, which creates resilience and develop emotional well-being. I can actually see a comparison with my own daughter and one of her friends. My daughter had a bit of more freedom than her and was able to go around our local area, building dens, climbing trees, whereas her friend was restricted due to family circumstances within the cul-de-sac area. I look at my daughter and I think, she's got quite a lot of resilience. She likes to experience these new things. She's quite confident. Whereas our friend, who had a limited experience within her outdoor play, now has some anxieties in situations and has less resilience with my daughter. And I compare that and think, is that because my daughter did have freedom to play outdoors and she never? Outdoor play enables children to express feelings and behaviours that are not always positive and can be a place to let off steam, to express anxieties, emotions, and it allows children to build confidence in various environments and situations. There is an expectation within Fife early learning and childcare settings that outdoor play provision offers opportunities for learning through discovery and investigation, building, transport, nature, shelter, physical activities, and being creative. It is our responsibility to resource outdoor areas to facilitate different types of play and develop our pedagogy towards outdoor learning. This is our Fife Council core provision document that all settings use. Okay, we've looked at why I did this research project, so now we're going to look at how. What did I do? So my action research project examined literature to establish the importance of outdoor learning and demonstrate the impact this has on health and well-being. The topic was chosen after discussions with practitioners and management in my settings. This collaboration established that the topic was crucial at this time, and it reflected on inspection reports and nursery improvement or action plans. I recommended that a practitioner in each room reflect on health and well-being and outdoor play observations that they have recorded in their personal learning journals. These early years practitioners from 4 separate early learning and childcare settings completed questionnaires detailing their professional practice and practitioner knowledge. This was analysed to ascertain practitioners' appreciation of outdoor learning and how it can be developed to improve the health and well-being of nursery children aged 2 to 5 years. The research identified a need for improvement in observational recording and ethos towards outdoor learning. So, I developed a questionnaire on Microsoft Forms. And the questions were, what provision do you have in your outdoor area? Do you have direct access to outdoor area? Do the children have free flow access to outdoor area for the full session? If children do not have access to the outdoor area freely, explain why they don't have this. How would you describe your involvement in outdoor learning? What is your knowledge of outdoor learning? Do you observe children outdoors and record this and how this develops health and well-being? Are the wellbeing indicators from GIRFIC used to inform or record your observations? And if you are using the wellbeing indicators for observing children, please explain. And then the last question was, how do you reflect on your observations? And there's a slide with all the questions that were on the form. So I looked at the questionnaire results. Next. So question 1, staff gave details of the outdoor provision, and this highlighted areas which they could develop on. That's on the next sheet that you'll see on the next slide. Questions 2, 3 and 4. All settings had access to outdoor area, but only 5 out of 8 had free flow access for the full session. I discussed the reasons why with the teams and we worked together to change this. Question 5 and 6. All staff described their involvement in outdoor learning and their knowledge, which was varied, and identified experience and areas to improve. This could include further reading and any training that I could give teams. Questions 7 and 8, all settings observed children outdoors and recorded how this develops health and well-being. However, only half used the well-being indicators to inform or record observations. And the last question, question 10, staff reflected on their observations of outdoor learning by sharing them with their team. They were self-evaluating what had worked previously and what they could change. And that slide is just what I've said. So the sheet that I was talking about that showed what outdoor provision they had. I collated answers from question 1, which highlighted that settings could add resources to develop outdoor learning. And if you have a quick look through, you could see the gaps where they didn't have resources in their outdoor area, which after discussions they did then add. Developing outdoor learning further through the recording using the wellbeing indicators. So the next steps identified from a research project were to incorporate the wellbeing indicators to develop practitioners' recording of health and wellbeing. There was no further work necessary for my research project, but I wanted to carry this out. These were the next steps that I identified in my research project, and I felt it was important to carry this on. I wanted to record and present my work on Glow for other Fife nursery teams, but this opportunity became available to do it as a pedagogy pioneer to yourselves. And I want other practitioners to have the opportunity to now access my research project and what I've done. Dinacare Nursery Kirkcaldy. The management and nursery team were developing health and wellbeing as an improvement priority within their nursery improvement plan, or what they call Dinacare Action Plan. They continued to support me and were interested in developing this project further. So I was able to use my recording tool with them. Teamwork. I introduced a recording tool created by Education Scotland to the team, and we discussed how this would collect evidence on outdoor learning to promote health and wellbeing. 3 choices were discussed. 1, all practitioners in the team using the recording tool and PLJs for their key children, but this was decided that it would be very time consuming and it would be more paperwork for practitioners. 2, the 2 initial practitioners who answered the questions in my research project at the beginning would then record outdoor learning on the recording tool I introduced. The feeling though was this did not involve the whole team and everyone wanted to be involved. So I agreed to put the sheet in the outdoor learning hub in their garden, and the practitioner on outdoors that week had the responsibility of recording learning on this. This would continue for a period of 6 weeks, so the whole team had the opportunity to contribute. The Education Scotland recording tool. If you have a wee look, this has 8 boxes to record the learning using the Wellbeing Indicators Scenario, and also record Curriculum for Excellence outcomes in the small rectangular space at the top of the box. This is for the Curriculum for Excellence codes. Outdoor learning recorded by the Dinacare team. I've put the recording tool in half so you could see all sides of it. They recorded how the children were active, and you could see at the top how it links to the Curriculum for Excellence. They've put the codes in: respected, responsible and included. And then there's the other side, which has got nurtured, achieving, healthy and safe, and all their observations that recorded outdoors in those sections. So all the wellbeing indicators were considered when recording outdoor learning objectives, and this was recorded in Term 1, August to October 2021. We then went on to look at evaluating. So in evaluating health and wellbeing, using the Education Scotland recording tool with the GIRFECT wellbeing indicators, I sent the team a questionnaire to reflect on how the learning was recorded and the practitioners' views on using this way of recording health and wellbeing through outdoor learning. I asked the Donegal team to decide if they wanted to complete the questionnaire individually or as a team. They decided to complete this together as a team. They wanted to discuss and complete as a team, as this was the approach they were using while using the recording tool, so they wanted to keep it the same. So the findings. The team found this easy to use. All EYOs were involved in the recording. Gaps and strengths in PLJs were easy to identify, and the wheel was easy to use to spot areas to improve on. They observed that some children thrive whilst using the outdoor area, and they became more confident, resilient and enthusiastic. There was a focus on safety during the forest kindergarten. The team were fairly confident in their knowledge of GIRFIC, health and wellbeing and outdoor learning, but the tool supported their knowledge further. And since then, they have developed their forest visits, and they now go all day to the forest with lunch. And they actually had to consider a couple of things before they did this. Toileting was a big consideration, not just for the children, but for the staff, and hand washing in the forest. Obviously, they were going along Care Inspectorate guidance on this. And they're continuing to use the wellbeing indicators, which are evidenced in displays around the environment. And my conclusion, I've put watch this space. I have now considered using this recording tool, or how to record wellbeing in a different way, and I plan to discuss this further with management as a form of evidence gathering in another setting. I could have said this was a worthwhile project, which was effective for one setting, and I can clearly see health and wellbeing being promoted through outdoor learning. But for me, that's just not enough. What's the saying? I'm like a dog with a bone. I know I can develop this further to include positive outcomes for more children. And at the back, there are the references to all the reading and the quotes that I have within my presentation. Thank you very much for listening, and I hope you enjoyed it.